Hello, I'm Gail Anderson and I'm the project leader for the Compass project, which has been sponsored by ANZCART. Today I wanted to talk about the development of a skills lab to enhance technical competency training. So the code says that we need to be competent in animal use. So how do we prove that our researchers have actually met those competency standards with respect to the techniques and procedures that they're using? Certainly at the University of Adelaide, we have students joining us right throughout the year, as well as faculty members and postdocs arriving almost any time. So having an annual meeting or an annual training session wasn't really adequate to cover all of those needs, because people obviously didn't want to wait a whole year before they got their training. But we needed a mechanism to enhance the level of skills that they gained, and also to assess them that they were actually competent in those skills. We had the online ethics course, which actually has subsequently been replaced by the Compass core materials through the ANZCART site, and that provides the knowledge base. But we really needed a training venue to allow the students to practice, or the new members of staff to practice, and then a mechanism for assessing those skills once they'd acquired them. We wanted really to make sure that we had an adequate competency sign-off process. So we looked around and tried to find a skills training lab venue, and in the laboratory animal services area there had been a large animal surgery, and because of the moves of most of the large animal work to a facility that was no longer downtown, there was an old operating theatre that was actually being essentially mothballed. And that offered a terrific opportunity because it had a scrub sink already built in for training for aseptic technique, as well as pack opening and all of the things that any recovery surgery needs to provide full aseptic technique for recovery animals, whether they're rodents or other species. So what is a skills lab? It's a place really to allow the trainees to develop their technical skills without actually using animals. So we're providing them with a space that allows them to build their confidence and to have fun without being bitten or scratched, to work at their own pace, to work independently to some extent, as well as letting them meet our inanimate models. And we use the Swedish rats, Gossig and Ratter, and these replacements effectively, as well as mice, a smaller version of these guys, to replace their actual Norwegian rat friends. So let's take a look at some of the training stations that we've developed. So obviously almost all of the students need to do handling and scruffing and the capacity to be able to give a subcutaneous or often an intraperitoneal injection. So what we've done is put together models that will allow them to practice those technical skills. A lot of the students don't know how to actually draw up an aliquot of fluid. They don't know how to use a needle and syringe, so those things can all be done without having animals present. There are also injection models, and the little thing that looks remarkably like a child's swimming pool toy, which is exactly what it is, has a silicon membrane skin on it that allows you to elevate that skin above the central spongy centre, and that provides a really nice replicate for the tenting of skin when giving a subcutaneous injection. So this side allows them to draw up fluids, choose the correct needle size, choose the correct aliquot of fluid, get familiar with needles and syringes, putting their needles caps off, and you can see that there's a QR code on this particular station. By using the QR scanner on their phone, they can then go directly to the video that shows them the procedures with care, video of how to do this, and they're available freely online for use for training anywhere. So we didn't reproduce those because they're really well done through the UK site. When the model gets soggy, you can just squeeze it out and reuse it. These are available through Clark Rubber, and I think it cost about $10, so incredibly cost effective. For IV injections, we used one of the IKEA rats. This is Gossig Ratter, and put some very small silicon tubing, connected that up to some three-way stopcocks, and again wrapped that with Vet Wrap, which is the self-adhesive external bandaging material, again available through Provet. All of these things are basically IV lines and stopcocks you can get from Provet, the veterinary supplier. And this allows the students to practice drawing fluid or injecting fluid into the tail vein that they can actually palpate along the sides of the tail on the rat. And again, it's to get them used to drawing up fluids, the kind of angles that they need to inject, as well as the needle sizes and volumes that they would be able to use in either a rat or a mouse. And again, there's 2 QR codes on this particular station, such that the students can come in whenever with their phone, open that up, and then they've got the video to help them to see how to do this particular procedure. Similarly, for IP injections, we've got an IKEA mouse with a target drawn on it to show them the correct anatomic site for an intraperitoneal injection on the mouse's right side, but on the left, when looking at the upturned mouse, they can also practice scruffing on these. We also have some scruff guards in the area so that the more hesitant students can actually practice using those as well. Again, it's important for them to see where there's also an anatomic model of the rat abdominal cavity to show them where they're trying to avoid the aspects of the large bowel and bladder, so that they are familiar with those things, so that they can see that they have to basically head into the area where the small bowel would be. Again, there's a QR code here that shows them the video of this method from Procedures with Care. Intramuscular injections. Actually, at the University of Adelaide, we don't allow IM injections in mice because we feel that the volumes are too large for them, but they are able to do this in rats if need be. So again, showing them how to do an intramuscular injection to avoid the sciatic nerve, the needle sizes, the kinds of volumes that might be appropriate. And there's a different model for this one. Little Gerhardt has better legs, whereas the IKEA rats don't have much in the way of muscle development in their limbs. So this is a slightly more anatomically correct animal that can be used for injection placement to get the sense of where that would go. And again, some anatomic drawings to show them what to avoid, as well as a QR code to let them see the video of how that's done. The anaesthesia model is really a real anaesthetic machine. Again, it has the vaporizer that they would use if they're doing gaseous anaesthesia. This station tells them how to fill the isoflurane in the vaporizer. So again, step by step, and the machine is there. There's usually, this one's done under supervision. We don't leave the isoflurane out because potentially, obviously, we don't want people either wasting it or being exposed excessively to it. So this tends to be done with the technical staff from the lab in place, but it is there for them to see, and they can see how to undo the vaporizer and where the filling jigs would sit. Again, the anaesthesia set up for setting up an induction box and looking at where the charcoal canister is for the scavenged gases, and again, how to put that together, how to work the three-way stopcocks and the direction of gases, so they get a sense of how that all works, again, without animals being there, so that they can practice doing it, putting it together, putting it on, taking it off the machine. And this is the way we actually supply it to the researchers. They get a box with all of the kit in it, and they actually do have to do some assembly themselves to make sure that it works. So they get to play with this and again get a bit more confident that things work before they actually get to be assessed on this. Then the next things tend to be related to setting up for surgery. So we encourage anyone that can't be using buprenorphine for whatever reason, and it's often for the neurosurgical cases, to use local anaesthetic blocks. And again, by having some neoprene, the trainee can make a cut in that neoprene and practice doing overlapping injections so that they can get a sense of how much of the volume of local anaesthetic they can use on a mouse or a rat to do a local anaesthetic block of their surgical incision line. Again, for those that are actually doing recovery surgery, there's not tying boards. These allow them to, with large pieces of cord, And again, these are just purchased from haberdashery stores. The boards themselves are a piece of wood with some brass hooks that have been drilled in to take either a Penrose drain or heavy rubber bands, basically something that applies a little bit of tension so that when you're putting your suture on, you actually have to overcome a little bit of tension to get those two pieces together, so they can practice doing double throwed first passes so that they can get a sense of what a surgeon's knot looks like, or they can practice doing square knots. And again, there's a QR code that shows them a video of how to do this, but illustrations on the station itself to show them what a square knot should look like, so that even if they're just doing it en passant, not wanting to spend a lot of time, they can have a little practice. There's always a set of needle drivers and the cords there that they can just practice putting a few throws on, even if they're doing something else to enhance their technical skills. Again, looking at the different suture patterns, simple continuous is something that's frequently used in all sorts of settings, pretty basic technique. And there's embroidery rings with pieces of rubber. Again, these can be bought from Clark Rubber or haberdashery stores. There's a QR code to show them how to do that, as well as we leave out some expired suture materials and allow the students to practice using the needle drivers and forceps so that they can get a sense of the feel of those instruments before they actually start doing those on tissues themselves. Subcuticular closures, great for animals that want to chew because the knots are buried. Does take a little bit of skill, so again there's neoprene with a cut in it to allow them to actually try and practice burying that knot. And again, a QR code, linked video, suture materials are left there of suitable sizes for using in the neoprene, and some finer ones for rodent type practice. And then the dexterity trainer. A lot of the students have never used needle drivers or held scissors in an appropriate way for surgery. So again, getting them to use the correct grip and to actually be able to pick up things and to be increasingly manually dexterous with that instrument as a hand extension. So very simple things, using little coloured beads to place or pick them up with the needle drivers and place them between pieces of what essentially a little muffin baking tray. So again, things readily available to help them with their dexterity training. If they want to get competitive, they can actually have little competitions and time themselves to empty all of the beads from one side to the other and back again, and then have competitions between those in the lab group to see who can actually do that most quickly and accurately. Another one where they're actually picking up little pieces that look like mushroom caps and putting them into holes. So again, it's orienting using the instrument, or picking up in the correct orientation and placing that little mushroom into the drilled hole. And again, these are boards that made myself, and these little mushroom caps are available from Bunnings, so nothing that's particularly difficult to find, nor particularly expensive. And to get that circular type of motion that you need to get when you're moving your wrist to add dexterity to your needle passage through tissue, these is an idea that is really just a screw thread with a hex head bolt on it, so that you can actually screw that down using the needle driver. And again, it's a very simple task, but it can be done more quickly or more slowly to make it a little bit more competitive if you want to induce that, or the students can just practice whenever they feel so inclined. Blunt dissection was something that a lot of the students asked that they wanted some training. So again, this one was something that is a piece of neoprene Velcro sitting on a sticky piece of Velcro that then is on a clipboard. And again, by using the forceps and a pair of blunt scissors, you can actually develop a tissue plane and get a sense of what it takes to elevate the tissue and then introduce your scissors and open them so that you're actually doing that blunt dissection. Really simple, again, materials from Clark Rubber and a stationery shop, so nothing particularly expensive. Prepping for surgery, got a little bit more creative, putting pieces of faux fur on a clipboard so it can be taken off and washed. It's held down by some Velcro pieces underneath, so again it's reasonably stable. the students can actually clip that if they want to, and then they can prep it using their 3-stage chlorhexidine or betadine prep type materials with the soapy, the alcohol, and then the tincture of alcohol-based preparation solutions suitable for doing aseptic surgery. And again, there's a QR code here for them to look at the videos of that being done, so that they are reminded exactly how to do that, as well as using sterile instruments and gauzes to do that, so that we're maximising the cleanliness of the skin preparation. Again, clipping, prepping and draping. So the next step is draping, and again here is illustrated on a rat, but it's really just to get the students using the things like towel clips if they're using the larger animals. And we've also got some of the plasticized drapes that they can see and cut holes in and actually practice for doing rodent surgery, so they have a transparent drape for that as well, and instructions on how to do that. Opening sterile packs is not something that's intuitive, and again there's some practice packs for them so that they can see the tape that's not been autoclaved, tape that has been autoclaved, and get a sense of how to wrap those packs with double wraps again. And then in the aseptic technique materials on Compass, there's a lot more information about how to do the packing of that, but this is really just aimed at looking at how you might set up a pack so that you've got a sterile outer wrap that then you can use as a ground sheet for the table, and then the inside wrap that you can actually have your instruments in at surgery. Preparing the surgeon and hand preparation, how to scrub using the two methods that are most common at this stage, the older fashioned method of having an impregnated scrub brush that's got chlorhexidine or betadine in it, and again there's a QR code to show them how to do that. And then above you can see that there's a QR code that shows them how to do the hand sanitization method, which of course has become way too familiar to us more recently with COVID. But there are surgical hand preps that are essentially alcohol based that can be used in this way as well as a traditional scrubbing station. Because we're in the old theatre area, there are actually taps and the Chlorhex scrub that you can use to actually do a full scrub and prep. And then, of course, the next step is preparing the surgeon themselves by putting their sterile gloves on. And again, this is quite tricky, so it needs some practicing. So there's gloves there that they can use, as well as the video to show them how to do that. And then the removal of gloves, because obviously if you've been dealing with neoplastic cells or with contaminated materials, you really don't want to be introducing that into the environment. So getting those off without touching the contaminated surfaces is a little bit of a trick. So there's some guidance on how to do that. And then things that I have noticed surgery students or trainees having troubles with is just orienting the scalpel blade the right way to put it onto a scalpel handle, getting the numbers of the scalpel series right for the particular scalpel handle as well, and then taking that on and off without actually doing yourself any damage by using an instrument. Again, all things that you certainly don't need an animal there to be practicing that on, and if you're trying to do that for the first time when you've got an anesthetized animal, all it's doing is increasing your operation time. So again, doing these things so that the students become comfortable with them prior to actually getting access to any live animals is really helpful. So how to use the Skills Lab. We've set up a training cycle design, and this really involves when the application for the approval to do a particular technique is put forward to the AEC, there are SOPs attached to that that have been approved by the AEC previously, and so the students know which of the SOPs that they need to be adept at to fulfill the requirements of that AEC approval. So they've done the Compass core training, so they've got the knowledge of the code and what their responsibilities are, as well as adverse events and the things that are included in that training. And then they're also guided through an orientation session to the relevant skills they'll need. The SOPs are also available in the Skills Lab so that they can see those and refresh their memories. And then there's a direct one-on-one or one-on-two or three session with one of the laboratory animal staff or one of the vets to guide them through what they need to do, show them the particular parts of the skill suite that are relevant to them, as well as highlighting to them that the Compass training, the phase 2 materials are available to let them look at the aseptic technique methods or anesthesia methods or potentially post-mortem methods or other things that are now available in that second phase of the Compass materials. Then they go away and do some independent practice after that orientation and initial training session. They can use the QR codes to repeat, and they can come and go from the skills lab as much as they want to. And then after that, when they feel as though they're getting fairly capable, they can either book in for an assessment, or if they need to do that skill on a live animal, they can actually be assessed with a live animal. And if that isn't successful, then they can actually go away and do some more practice with their research supervisor supervising that skill and come back at a later stage for assessment. Or if they've already achieved an adequate competency, they can be signed off at that point. So it's an iterative process. Depends very much on the student's previous experience. We get students right from starting their honours and they've had very little animal experience to folks obviously that are postdocs that may have done a lot of laboratory animal work or other animal work in their previous research training. So the competency checklists will make up phase 3 of the Compass training, and these are really guides to the trainers and the trainees as to what the skills will be for each of the things that they're being assessed for. So breaking it down into steps so that they are then able to see what they need to achieve as per essentially the SOP for that particular technique or procedure. And they'll be assessed then as either exceeding expectations, terrific, meets expectations, great, borderline, they've got to come back again, or below expectations, they need to do significantly more training before they'll be signed off as competent and allowed to do that independently. So the trainees get to see these forms so that they know what's expected of them, they know the steps, they can come in and they can practice those in the skills suite by themselves, and then they can, before they progress to any live animal interactions. And if they fail, they also know what they need to focus on, and so that there's a good set of guides for them. And it also allows the different assessors to have very much the competency training checklist gives them a real framework so that there's consistency between the assessors. So the advantages of this training framework, and I won't read all of these for you, but effectively we've said that we've got a scaffold that allows training that's a bit more independent. It's not dependent on an individual assessor because you've got a guideline for them, and you've got the materials that you can scaffold from offered by the Compass materials online in phases: core, phase 2 for the techniques, and phase 3 for the training materials. So advantages for using the Compass as a scaffolding really is you can use the whole package, or you can just use the Compass core materials for AEC members or for knowledge-based acquisition. You can use the technique modules for scaffolding training, or you can use the lot effectively with the phase 3 guidelines for the trainers and trainees as well. So thank you very much for your attention, and happy to take questions at this stage. Thank you.